Christina. I am a parent of two type 1 diabetic sons. So I just wanted to take a few minutes and explain a little bit about type 1 diabetes, the effects that it has on children, not only children, but the caregivers as well, the caregivers are parents, grandparents, friends, anybody who is caring for those children, or it could be spouses when the kids grow up and get married. So, first of all, our son is 12, almost 13. His name is Ethan. He was diagnosed with type 1 diabetes when he was 5. My husband and I thought that he had a bladder infection or a urinary tract infection, something of that nature. He was urinating a lot more than usual. Frequent thirst. We thought he is a kid. He's playing around a lot, so he's constantly thirsty. We let it go for about 2 weeks. But eventually, his preschool called and said that they were noticing it as well. So we went ahead and took him to the doctor. So when we get to the doctor's office, we obviously said, okay, we don't think it's a big deal, but we're here just because we've noticed it. His school's noticed it. So can you help us out? Well, turns out the urinalysis tests were normal, so the doctor comes in, does a simple blood prick on his finger for blood. Comes back that it was high. Normal blood sugar is between 80 and 120. His was about 360 or so at the time. So she had us go directly to the ER. When we get to the ER, they immediately admitted us and said, yeah, it's definitely type 1 diabetes. You'll be here for about a week or so. So we spent about a week meeting with dietitians, doctors, mental health specialists, just to kind of get the emotional aspect out of the way, but also try to teach us what our new normal was going to be for life. They wanted to really stress the impacts that diabetes can have on a person as they get older if the diabetes is not well maintained and controlled. So as a child, you want to let them eat what they want without having to hover over them all the time and make them feel like they're missing out on a little bit of life. So we let our children eat what within reason, what they want. While also trying to maintain a good A1C and a good blood sugar. So if you don't maintain a good A1C and a good blood sugar when you're younger, as you get older, you can have a lot of medical issues. High blood sugar and A1C can lead to other autoimmune diseases. When you have diabetes, you're more common to have other autoimmune diseases such as celiac disease and whatnot. It can also lead to heart attack and to stroke, blindness, amputation of feet and legs and possibly arms as well. So it can have a lot of effects on kids, but it can also affect the caregivers as well. When you're a caregiver of a patient or of a person who has diabetes, whether it be your kid or your grandkid, or when that person grows up and now you're the spouse of that person with diabetes, it can have an effect on someone. You are essentially in charge of not only their well-being, but their health as well. So signs of caregiver burnout could be, just exhaustion, not eating, anxiety, depression, things of that nature. So really, I think, in my opinion, as a parent of not only one, but two diabetics, in order to alleviate the stress on the patient, the kid or the adult, let them eat what they want. Just get in moderation, give them insulin for it, to let them know that they are still a child. They shouldn't be singled out when it comes to food and to birthday parties and such. They don't leave them out of things. Just give them insulin and give them coverage and let them go on with life. But as a caregiver, you are in charge of that person's health. You should make a priority of putting yourself first every once in a while. You cannot let yourself feel bogged down. Try to go to therapy sessions. One-on-one therapy is great. I've done that multiple times. If one-on-one therapy is not your thing, there's group therapy. If therapy itself isn't your thing, try to hang out with your friends as much as possible. If you're a woman, go get a manicure, a pedicure, go get massages, go to the movie, lay outside in your hammock and read a book. Just, kind of put yourself first and, really just try to relax and unwind. Thank you for listening to my speech about diabetes. It's a very important issue not only in my life, but in my family's life, because my family also has to deal with it. But it's going to be important in my life as a nurse. I already know the signs and symptoms, so that's going to be forefront in my mind when patients come in and they're experiencing some things that my son's experienced. And I do have some experience with the emotional aspect of it as well, so I should be able to help my patients with that as well in the future. All right, everybody, thanks for listening. Have a good day.